طبعا these definitions you need just to know. It's very important for your future as well, not only for the exam. Definitions: neoplasia is non-stopping growth of abnormal cell mass with no control by normal growth stimulus. Dysplasia: uncontrolled cellular division of abnormal cell mass with no invasion or ability to spread distally. Metastasis: the ability of the cell mass to spread and survive in a place distant from the primary source. We have benign tumor, locally malignant tumor, or malignant tumor. Benign tumor, uncontrolled cell mass division with no propensity to invade, metastasize, or recur, whereas the locally malignant tumor, uncontrolled cell mass division with local invasion and infiltration with no ability for distance metastasis. هذا الفرق بينه وبين الكانسر. Malignant tumor is able to invade, metastasize, and recur after surgical removal. What are the carcinogenesis? The process of cellular transformation from normal cell into malignant cell. Stimulus called carcinogen, like hormone or gene. It could be hormonal, genetic, radiation, infection, toxin, or chemical. Apoptosis, cellular atrophy. طبعا عندنا مراحل التيومر. So cell with a mutation, hyperplasia, dysplasia, then in situ cancer when it's invade the basement membrane, then invasive cancer. هنا ندخل في الكلام المهم. What are the difference between the carcinoma, or when we call it carcinoma, when we call it sarcoma? Carcinoma لما يكون malignancy في endothelial cells, sarcoma لما يكون في mesenchymal cells, or sometimes undifferentiated cancer. الcarcinoma spread distally through either lymphatics or hematogenous, okay, or could be spread through the peritoneum or pleura. Diagnosis: malignant tumor. So sometimes the patient presents with non-specific symptoms like loss of weight, fever, generalized fatigue and illness. Tumor itself sometimes cause the symptoms like mass. يصير عندي the patient complain of palpable mass or something mass coming out, or bleeding or infection or obstruction. The tumor can cause compression, and the patient comes to you secondary to the compression symptoms like jaundice, bowel obstruction, space occupying lesion, or metastasize, unfortunately, like to the lymph nodes, bone, lung, or brain. Locally, this is about that's about malignant tumor presentation. What about locally malignant tumor presentation? They can also present with mass, ulcer, bleeding, obstruction, or pain. Benign tumor, most of the time, they present with mass or compression symptoms. احنا عندنا شغلتين، في عندنا staging and grading. Okay, staging, it's usually clinical for malignant tumors, for diagnosis, prognosis, and the treatment we use. So T and M, T tumor size and local invasion, N lymph node status, M distance metastasis. Okay, it's very important for me to know what is staging and what is grading and when it can be used. لكن ما يحتاج اني احفظ exactly يعني الارقام هذه او numbers. Okay, whereas grading is histopathological classification, right? So based upon the microscopic appearance of the neoplasm, in general, high grade means that there is a less degree of differentiation and the worse biologic behavior of malignant neoplasm will be. So grade G1, grade 1 well differentiated, grade 2 moderately differentiated, grade 3 poorly differentiated, and grade 4 nearly anaplastic. واضح؟ سواء اللي أبغاه منكم فقط أنكم تعرفون إيش الفرق بين الجريدنج اللي هي used with the histopathology والstaging اللي clinical classification. Prevention of cancer in general, avoid exposure for some cancer like ultraviolet rays or irradiation. Periodic self-examination is very important for some of the cancers like postmenopausal. Breast self-examination, screening is very important like endoscopy, biopsy, imaging, laboratory for some of the cancers. Vaccination is important like hepatitis B vaccine. Chemoprophylaxis like aspirin and colorectal cancer. Screening for patients at high risk, okay, for some type of cancer like those with family history, okay. For example, breast cancer annual mammogram and breast ultrasound, colorectal cancer occult blood test and annual colonoscopy, prostate cancer checking the PSA. Tumor markers, there are a lot of tumor markers, okay, substance which is released or secreted in the large quantity by cancer cell or in a small quantities by normal cell. They are not accurate in the diagnosis, this is very important, or prognosis, but play an important role in the follow-up. So it's not very accurate. If it could be secreted in some of the benign condition, but it's important if you already diagnose the cancer to follow up. Treatment of cancer in general, it's always treated by a multidisciplinary team, like medical oncology, radiology, oncosurgeon, psychiatrist, nutrition, palliative. Tissue biopsy must be obtained to emphasize the presence of malignancy and for hormonal and histochemical study. Usually it's early and localized tumor surgical resection. What does that mean? I mean, usually in the early stage or localized or intermediate stage, surgical resection plays a major role in the treatment with some adjunctive radiotherapy or chemotherapy. But unfortunately, if the tumor gets metastasized, usually it's just end up with palliative treatment with either chemo or radio or palliation only. So in locally advanced tumor, new adjunctive chemo or radiotherapy with surgical resection, metastatic tumor, mainly chemotherapy. Surgical removal might be curative or palliative. We have to remember this as well. Sometimes you do the surgery, you know there is a metastasis. You're not doing the surgery to treat the tumor, you just to treat the symptom that caused by the tumor. For example, bowel obstruction. You just like do a stoma to release the bowel, okay? As a palliative procedure. Follow-up, self-examination like breast, for example, examination, clinical and physical checkup, laboratory like tumor marker, radiological, either with ultrasound, CT, MRI, endoscopic, surgical, or laparoscopy. Points to remember: neoplasia may be benign, malignant, or locally malignant. Malignancy carries the fastest growth rate, invasion, bleeding, necrosis, metastasis. Pre-malignant stage, which is the high-risk patient, should be in close follow-up. Metastasis, like distant spread, might be hematological, lymphatic, or transcolamic, or with natural flow. Carcinoma spread early through lymph nodes. Blood spread is early in sarcomas and indifferentiated tumor. Commonly affected organ for metastasis اللي هي liver, lung, bone, and brain. Screening, early detection, and treatment decrease the death rate of malignancy. Treatment and prognosis depend on tumor stage اللي هي اللي قلناها clinical staging. Treatment is a multidisciplinary team. It's very important. Curative surgical treatment in early stage and chemotherapy in systemic advanced stages. Any question?